So I was asked to speak about aging well with the rarer types of Ehlers-Danlos syndrome. And I would say that our first two speakers this morning have done a really good job in starting us thinking off about how to do that. There's very little evidence in the medical literature about aging with the rarer types, and this is one of the things that we really need a lot more research about in the future. But I'm going to tell you just some thoughts that came to me as I was thinking about this topic. We sort of have these ideas in our mind about what happens to us as we get older. We expect, that there's going to be a certain amount of decline in our aging years, and that we might become a little bit more stooped. We might depend on some kind of assistive device. We might be less able to get around and do the things we love to do. And it really doesn't have to be this way. There are a lot of things that we can do, and you've heard from Valerie about some of them that can optimize the years that we have after we think we've gone through the prime of our lives. So in my thinking about aging well with the rarer types of Ehlers-Danlos syndrome, I thought, first of all, knowing the risks associated with your specific type. And I thought Katie did a really outstanding job of presenting some ways of thinking about that and preparing for those. And then once you know those risks associated with your type, know the general guidelines for aging well. For people just, being human, what are some things that we can do to age well, and then act accordingly. So this table gives a list of some of the specific issues associated with the rarer types of Ehlers-Danlos syndrome. And you can see that the cardiovascular type of Ehlers-Danlos syndrome is associated with progressive valvular heart disease, that there are a number of different types, including vascular, kyphoscoliotic, and the spondylodysplastic types that are associated with aortic or arterial aneurysms, dissections, and ruptures. Pneumothorax is seen in both vascular and the musculocontractural type. And we see risks of bowel rupture and colonic diverticula in some of the different types, and uterine and bowel bladder rupture, et cetera. So just knowing, as Katie said, what are the types, what are the issues that are associated with your particular type, and having an emergency preparedness plan in place is very important. So it's important to know the signs and symptoms of these issues. So when we think about severe progressive valvular heart disease, it's progressive shortness of breath, and those can be seen, the valvular heart disease is evident on echocardiogram. Aortic dissection or rupture, obviously a major emergent situation with acute chest pain that may go to the back, and that will be picked up on an MRI or CT scan, requires emergent surgical therapy. For pneumothorax, we may get acute shortness of breath and pain in the chest, and that will be evident on a chest X-ray. Bowel rupture, acute abdominal pain, evident on abdominal X-ray, and uterine rupture with acute pelvic or abdominal pain, fetal distress, because this often happens in the third trimester of pregnancy, and vaginal bleeding. So that is definitely a gynecologic or obstetric emergency. So just knowing that recognizing what might present is an important thing, and as Katie so beautifully presented, to have an emergency plan for dealing with those. And then knowing that you have the preparation in place, putting it aside and letting go of those things that are out of your control. Then we come to the 4 pillars of aging well for humans in general. And these are nutrition and hydration, movement, stress reduction, and sleep. When we think about nutrition for healthy aging, you want to make sure that your diet is including all the recommended daily allowance of vitamins and minerals. You want to be getting at least those 5 to 7 servings of vegetables and fruit every day. And we talk about eating the rainbow, which means choosing foods with a wide range of different colors to get your optimal phytonutrients. You want to make sure you're choosing healthy fats, the mono and polyunsaturated fats, and I'll give you some examples of what those foods that include those. And also, I think it's just really, really important for all of us to be getting enough protein to optimize muscle health. And I'll show you a calculator that you can use to figure out what that would look like for your particular situation. You want to be avoiding processed foods. You want to choose whole foods prepared simply. So the healthy fats are the monosaturated and polyunsaturated fats, and these are just some examples of foods that contain those types of fats. The monosaturated fats include peanut butter, almonds, cashews, hazelnuts, peanuts, pistachios, a number of different types of oils. And the polyunsaturated fats are found in oily fishes, rapeseed oil and sunflower and corn oil, and some nuts. This protein calculator, I think, is really a useful tool. Many of us are not getting enough protein to optimize our muscle health. So if you put in your age, your gender, your height and weight, and your activity level into this protein calculator, it will give you an idea of how many grams of protein you should be consuming every day. So in this example, we have a 25-year-old female, 5'6", 160 pounds, who does light exercise 1 to 3 times a week. And I thought I had put in the calculation there, but if you hit that calculate button, then that will tell you for that particular person how many grams of protein would be optimal daily. So we always talk about hydration for people with POTS, but even for people without POTS, it's really important to stay hydrated. We had a wonderful session yesterday on the fascia and the importance of hydration for fascia and for movement of the fascia. And we all need water. Our body is 50 to 60% water. So adequate hydration is important for everyone. And the aim is to drink about half your weight in pounds in ounces of water. So for example, a 140-pound person should aim to drink about 70 ounces of water. And I can tell you, most of us fall way short of that. So that's just a goal. Now, in terms of movement for optimal aging, Valerie just gave you some wonderful hints about that, and there were some absolutely fabulous presentations over the last 3 days about movement and optimizing movement and ways to think about movement. We had a really great presentation about exergaming and making exercise fun. And I really recommend those presentations to you. They will be available, even if you weren't registered for the early part of the conference, they'll be available in a couple of weeks. So physical capacity in general decreases dramatically with age if people are not strength training. We lose an average of 5 pounds of muscle tissue per decade due to disuse. 5 pounds of muscle, it's really a lot. A woman who doesn't strength train loses about 0.5 pounds of muscle every year. So there is good peer-reviewed evidence that exercise really does help. Several weeks of traditional strength training result in about 3 pounds of more muscle and 4 pounds less fat in older adults. And this rate of body composition improvement appears to continue for several months. So again, find the things you love and that bring joy to your life, and do those things, and it will help both your mind and your body. So strength training is really the key to maintaining muscle mass. A 5 pound per decade loss of muscle tissue accounts for a 3% per decade lowering of the resting metabolic rate. And that in turn is likely to result in more weight being put on. So the strength training raises the resting metabolic rate, resulting in more calories burned on a daily basis, and a 7 to 8% increase in the resting metabolic rate can be experienced after several weeks of regular resistance training. There's good data out there that this is really helpful to maintaining a body that can carry you well into your golden years, if we may. Okay. So other considerations about movement and things that are very important to work on as we're aging are balance and pacing, and also cardiovascular fitness in addition to our musculoskeletal fitness, our muscle strength. So balance is super important because falls are a major, major cause of morbidity for older adults. And so I'm sure Valerie would agree that that's really one of the things that we need to work on. I was talking with Maggie Buckley about this this past week, and she recommends to her clients that they stand on one foot while they're brushing their teeth. So, if you're brushing the left side of your mouth, stand on your left foot, hold your right foot up, and when you're brushing the other side, hold your left foot up. And if you're doing your toothbrushing right, then you're going to get about 2 minutes of balance training every time you brush your teeth, and that is an easy way to fit that in. We all know how important pacing is, and it's something that is important, again, both for mental health and for physical health. If you're pushing, you're not going to be able to keep it up, and then the effort collapses. So making sure that you have built-in rest time, and both for your mental and physical well-being, this is very, very important. And for the cardiovascular fitness in general, I recommend to people to aim for 30 to 40 minutes of low impact activity most days of the week. So that would be 4 or 5 days out of the week. But here again, it doesn't have to be all at once. It should be something you really enjoy doing. You can do 6 5-minute walks. That gets you 30 minutes of walking. You can break it up any way you like, and if you are at a place where the idea of exercising for 30 or 40 minutes just seems completely impossible, start with 2 minutes. And if you do 2 minutes today and add 1 minute every time you exercise, in a month, you'll be doing 30 minutes. So small baby steps, gradually increasing, having goals, but small increments is really the way to go. And just giving yourself grace, as Valerie said, for showing up and making the effort. So stress reduction is another huge, huge component of aging well. And we all know that people living with the rarer types are under an inordinate amount of stress. There's the stress of living with a rare disease, a chronic condition, the risk of catastrophic events. All of these are very big contributors to stress. So how can we control them? One very important thing is adhering to the principles that Katie gave us this morning with the emergency preparedness, and knowing that you've done everything that you can do to make sure that if there is an emergency, you will be able to take care of it in the best possible way. And then once you've taken care of that, other strategies for stress reduction include exercise. Valerie told you those endorphins are going to really help you feel better once you're exercising. Mindfulness and meditation are really very, very useful strategies and very important for keeping ourselves in a settled state. And there is more and more evidence now that social engagement and meaningful activities and relationships are really crucial for aging in a very healthy and aging well. So mindfulness-based stress reduction was developed by Jon Kabat-Zinn at the University of Massachusetts. This provides guided meditation to minimize stress. And Dr. Kabat-Zinn initially designed it as a 10-week program. You would go once a week to a 2-hour program and do these guided meditations. But these programs are now available at no cost at this website, palouse-mindfulness.com. So I highly recommend this to you. It's a way of learning how to sort of be present, be tuned into your body, and to relax. And it's a really excellent program for stress reduction. There are another couple of apps that are out there for guided meditations. One of them is called Calm. There's another one called Headspace. And both of those have different narrators or guided meditation guides, if you will, people who are speaking you through different meditations. And you can kind of choose the voice that resonates best with you and choose the topic that's most useful for you. There are meditations for sleep, for anxiety, for all different kinds of stressors in our lives. So both Calm and Headspace are freely available as well online. Okay, we know that sleep is crucial to mental health, to stress reduction, to pain management. The human body does not do well without sleep. In fact, there's a reason that people use sleep deprivation as a form of torture. So it's really important to get our sleep right. The proper sleep hygiene involves setting a schedule and a routine, being ready to tell your body that it's time to start winding down. You want to try to avoid blue lights for 2 hours prior to sleep, and if that's just not possible for you, there are glasses that you can use that minimize the amount of blue light that comes into your eyes. So you can use those in the 2 hours before you're sleeping. You want to try to avoid eating for 2 hours before sleep. A warm shower can help a lot of people just kind of get your body ready to wind down for sleep. Some people find that a white noise or fan kind of thing in the bedroom is helpful. And you want your room to be as dark as possible. With blackout curtains can be really helpful. You're going to sleep best if there's no light in the room. Also, the temperature of the room is really important. In general, our bodies sleep better if it's a little bit cooler. Now, here's a little bit of science about aging. We know that the telomeres protect the genes in the chromosomes, and telomere length, when we look at those telomeres on the chromosomes, the telomere length declines in dividing cells as we get older. But we know that there are some things that are particularly associated with telomere shortening. They shorten with age. They shorten with low EPA and DHA levels, the low levels of those healthy fats. They're shorter in people who don't exercise and shorter in people with lower levels of nitric oxide circulating in their blood. Nitric oxide is this molecule with one atom of nitrogen and one of oxygen. And foods that enhance nitric oxide production are listed on this slide. So we're back to our nutrition, and you can see they have a wide range of colors. back to eating the rainbow. So I'd like to recommend to you The Secrets of the Blue Zone, which is a series on Netflix where he discusses 5 communities around the globe where people live unusually long and vibrant lives. And it's a really entertaining series and supports the idea that a healthy diet, exercise, meaningful social relationships, and purpose are crucial for living long and healthy lives. So thank you so much for your attention. Thanks to Maggie Buckley for helping me think about some of these issues, and I look forward to discussing them with you in the Q&A.